This recording will go over alkalosis. Alkalosis occurs when there's an excess of bases, especially bicarbonate. The amount and strength of the bases is greater than normal compared with the amount of acids. Alkalosis is a decrease in the free hydrogen ion level of the blood and is reflected by an arterial blood pH above 7.45. So remember, pH and hydrogen ions are inversely related. If the hydrogen ions decrease, go down, that means the pH is going to go up. In this case, above 7.45. Metabolic alkalosis is an imbalance caused by either an increase of bases, so a base excess, or a decrease of acids, an acid deficit. Base excess is caused by excessive use or an excessive bases, I should say. And an example would be an oral intake of antacids in an excessive amount. Other base excesses can occur during medical treatments, such as citrate excess during massive blood transfusions, IV administration of sodium bicarb, and TPN. Acid deficit or decrease of acid components can also lead to metabolic alkalosis. Some causes of metabolic alkalosis due to acid deficits include prolonged vomiting or NG suctioning. So in both of those situations, the contents of the stomach are being removed. And if you think of when you do vomit, it does have an acidic taste. So you can remember you're losing acids out of your stomach, whether it's vomiting or NG suctioning, and that can lead to metabolic alkalosis. Other conditions that can cause this are endocrine conditions such as hypercortisolism and hyperaldosteronism. Another cause would be thiazide diuretics. ABGs of the patient with metabolic alkalosis include increased pH and increased bicarbonate level with normal oxygen and carbon dioxide levels. Respiratory alkalosis is caused by excessive loss of carbon dioxide, usually through hyperventilation. Patients may hyperventilate in response to anxiety, fear, or improper settings on mechanical ventilators. Hyperventilation can also result from direct stimulation of central respiratory centers because of fever, central nervous system lesions, and salicylates. Other causes include high altitudes, shock, and early stage acute pulmonary problems. The hallmark of respiratory alkalosis is an ABG with increased pH, because we're talking about alkalosis, coupled with low CO2 levels. And so what were the normal CO2 levels of an ABG? So hopefully you remembered you just lose the 7 for the pH and you're left with 35 to 45 for CO2, so less than 35 would result in, and also with the higher pH. Oxygen and bicarb are usually normal. In terms of assessment and noticing, the symptoms of problems with imbalances are the same whether they're metabolic or respiratory alkalosis. Many of the symptoms are the result of hypocalcemia and hypokalemia. So if you're a little rusty on those, you'll want to revisit those. CNS changes are caused by overexcitement of the central nervous system. So remember how the pH goes, that's how the body goes. So with alkalosis, the pH is getting turned up, and then all the body systems are getting turned up. So with the central nervous system, there's overexcitement. Patient may have dizziness, agitation, confusion, hyperreflexia, and it can progress to seizures. Tingling or numbness may occur around the mouth and in the toes. Those can be related to that calcium imbalance, as well as positive Volstex or Trousseau sign. Again, if you're rusty on those, you want to go ahead and review signs and symptoms of hypocalcemia and hypokalemia. In terms of neuromuscular changes, nervous system activity increases, just like the pH, causing muscle cramps, twitches, and Charlie horses. Deep tendon reflexes are hyperactive. Tetany is a continuous contraction of muscle groups. So sort of like the Charlie horse would be like a tetany. It's painful and indicates a rapidly worsening condition. So that muscle just contracts, but with the Charlie horse, you can sort of get up and walk it off. You can't with tetany. It's just that constant contraction. Skeletal muscles may contract as a result of nerve stimulation, but they become weaker because of hypokalemia. Cardiovascular changes include increased heart rate, normal or low blood pressure, and increased risk for digitalis toxicity. And if you remember digoxin, digoxin and low potassium don't play well together. So that's because of the low potassium that's associated with alkalosis that there's a problem with dig toxicity. Then finally, respiratory signs and symptoms, increased rate and depth of ventilation and respiratory alkalosis, and decreased respiratory effort associated with skeletal muscle weakness and metabolic alkalosis. In terms of interventions or responding for alkalosis, interventions are planned to prevent further loss of hydrogen, potassium, calcium, and chloride ions, to restore fluid balance and to monitor for changes, and to provide for patient safety. Treatment just deals with whatever is causing the alkalosis. So if it's prolonged NG suction, that would be addressed. If it's a certain infusion of a certain type of IV solution or drug, that would be addressed or stopped or modified. The patient with metabolic acidosis caused by diuretic therapy receives fluid and electrolytes replacements, and the diuretic therapy is adjusted or stopped. Antiemetics are given for the patient who is vomiting. During correction of alkalosis, a nursing care priority is prevention of injury from falls. The patient with alkalosis has hypotension and muscle weakness, which can increase the risk for falls, especially among older adults.